Hands and wrists and even elbows become very stiff after even short periods of time of mobilization. And over the past 10 to 15 years, the field of hand and upper extremity surgery has moved from prolonged immobilizations to getting patients moving as rapidly as possible. I'm Dr. Shulman. I am an orthopedic surgeon with a special interest in hand and upper extremity surgery, as well as traumatic injuries throughout the body. Wide-awake hand surgery is a relatively new technique that has really allowed us to change the way we treat common surgical hand problems. So traditionally, surgery is needed to be performed with general anesthesia. However, there are challenges that come with administering anesthesia. By having a procedure done wide awake, a lot of the preoperative testing and difficulties that go along with having anesthesia can be alleviated or obviated. There's no need for preoperative testing if you're not having anesthesia. There's often no need to have a ride home if you are simply having an injection in the hand, similar like we might give you in the office. What wide-awake surgery is what really is called WALINT, or wide-awake local anesthesia no tourniquet. We can give a single injection that both provides anesthesia, which is really numbing, and hemostasis, which means that there is no blood in our operative field. There are really three procedures that I think are most amenable to being performed wide awake. The first is a carpal tunnel release, which is one of the most common operations we do. The second would be a trigger finger release, which is probably the most common operation we do. And the third would be a release of the first dorsal compartment, well known as de Quervain's tendonitis, and this is a common tendonitis that people get in their wrists. Not only is this procedure quite safe and easier for patients to do, but oftentimes we can actually get frequently better results by doing these procedures wide awake and being able to test our surgical treatment in real time instead of waiting for a later time. Overall, my goal is always to get patients moving as quickly as possible and back to their baseline level of activity as quickly as possible. And I employ techniques surgically in order to have my patients have the most rapid recovery possible for their condition.